Which of the following is the primary physiological difference between VA, veno-arterial, and VV, veno-venous, ECMO? A. VA ECMO provides only respiratory support. B. VV ECMO provides both respiratory and hemodynamic support. C. VA ECMO provides both respiratory and hemodynamic support. D. VV ECMO bypasses the native heart. Answer: C. VA ECMO provides both respiratory and hemodynamic support. Explanation: VA ECMO takes blood from the venous system and returns it to the arterial system, effectively bypassing both the heart and lungs, thus providing circulatory support. VV ECMO returns blood to the venous system. It requires a functioning heart to pump the oxygenated blood. In VV ECMO, recirculation is best described as A. Blood leaking from the oxygenator back into the pump. B. Oxygenated blood from the return cannula being immediately pulled back into the drainage cannula. C. The backup of blood into the right atrium. D. Failure of the sweep gas to remove CO2. Answer: B. Oxygenated blood from the return cannula being immediately pulled back into the drainage cannula. Explanation: recirculation occurs when the oxygenated blood exiting the return cannula is sucked back into the drainage cannula before it can reach the systemic circulation. This reduces the efficiency of the ECMO circuit. Which parameter is the most direct indicator of oxygenator efficiency regarding CO2 removal? A. Pump speed, RPM. B. Sweep gas flow rate. C. Fraction of inspired oxygen, FiO2. D. Premembrane pressure. Answer: B. Sweep gas flow rate. Explanation: while O2 transfer is limited by blood flow, CO2 clearance is primarily determined by the sweep gas flow rate. Increasing the sweep gas washes out more CO2 from the blood. North-South syndrome, Harlequin syndrome, is a complication specific to A. Femoral VA ECMO. B. Internal jugular VV ECMO. C. Central VA ECMO. D. Dual-lumen VV ECMO. Answer: A. Femoral VA ECMO. Explanation: in peripheral VA ECMO, femoral, the ECMO flow competes with the heart's own output. If the lungs are poorly oxygenated but the heart begins to recover, the upper body, head/arms, receives deoxygenated blood from the heart, while the lower body receives oxygenated blood from the ECMO. A sudden drop in ECMO flow accompanied by chattering or shaking of the drainage lines usually indicates A. Oxygenator failure. B. High afterload. C. Hypovolemia or suck down. D. Excessive sweep gas flow. Answer: C. Hypovolemia or suck down. Explanation: line chattering occurs when the drainage cannula is pulling against a collapsed vein, usually due to hypovolemia, kinking, or excessive negative pressure, pump speed too high for available volume. Which of the following is a classic sign of oxygenator thrombosis? A. Decrease in postmembrane POW2. B. Increased pressure drop, delta P, across the oxygenator. C. Decrease in sweep gas flow. D. Both A and B. Answer: D. Both A and B. Explanation: as a clot forms in the oxygenator, resistance increases, raising the pressure gradient across the membrane, and the surface area for gas exchange decreases, lowering postmembrane oxygenation. What is the standard target for activated clotted time, ACT, in a stable ECMO patient? A. 100 to 120 seconds. B. 180 to 220 seconds. C. 300 to 400 seconds. D. Greater than 500 seconds. Answer: B. 180 to 220 seconds. Explanation: while targets vary by institutional protocol, a range of 180 to 220 seconds is commonly used to balance the risk of circuit thrombosis against the risk of systemic hemorrhage. In VV-ECMO, if the patient's systemic SAW2 is 85% despite a circuit FiO2 of 100%, the first step should be to A. Increase the sweep gas. B. Increase the ECMO blood flow rate, L/min. C. Decrease the patient's sedation. D. Change the oxygenator. Answer: B. Increase the ECMO blood flow rate, L/min. Explanation: systemic oxygenation in VV-ECMO depends on the ratio of ECMO flow to the patient's total cardiac output. If the patient is hypoxic, increasing the blood flow rate ensures a higher percentage of the cardiac output is being processed by the oxygenator. Which complication is most likely if the sweep gas is accidentally turned off? A. Rapidly rising PaCO2, hypercapnia. B. Circuit hemolysis. C. Immediate pump stop. D. Arterial air embolism. Answer: A. Rapidly rising PaCO2, hypercapnia. Explanation: the sweep gas is responsible for CO2 removal. If it stops, CO2 will rapidly accumulate in the blood, leading to respiratory acidosis, even if the blood is still being oxygenated by the pump. During VA-ECMO, an increase in afterload is primarily caused by A. The retrograde flow from the arterial cannula. B. Using a larger drainage cannula. C. Reducing the pump RPM. D. Patient vasodilation. Answer: A. The retrograde flow from the arterial cannula. Explanation: in peripheral VA-ECMO, blood is pumped upstream, retrograde, through the aorta. This creates significant resistance against which the left ventricle must pump, potentially leading to LV distension.